Welcome, everyone. I'm Hayden Bush with Kaufman Hall. Thanks for joining today's webinar, Building Relationships with the Modern Healthcare Consumer. Our speakers today are Kaufman Hall Managing Director Dan Claren and SG2 Associate Principal of Intelligence Charlotte Browns-Leva. Just a few housekeeping notes before we begin. If you have any questions for the speakers, please enter them into the webinar interface and we'll answer as many as possible at the end of the presentation. Also note you can download the latest consumer research reports from SG2 and Kaufman Hall from the Handouts tab on the webinar interface. Now I will turn the presentation over to Charlotte Browns-Leva. Welcome, Charlotte.
Thanks so much, Hayden. Welcome and glad to be here today with everyone. I'm Charlotte Browns-Leva, Associate Principal with SG2. Prior to joining SG2, I worked on the health system side for nearly 2 decades, primarily in direct-to-consumer leadership roles, cultivating brand development, awareness, engagement, and loyalty to help drive system, sustain business growth, and reputation.
Thanks, Charlotte, and it's a pleasure to be here with you today. I'm Dan Claren. I'm Managing Director with Kaufman Hall, working on a variety of strategies with health systems, private equity firms, healthcare disruptors around growth, consumer engagement, pricing, and partnerships. Spent some time with Walgreens and corporate strategy prior to my time with Kaufman Hall, and that gave me a really interesting lens through which to view the consumer in healthcare. We're really grateful that you all are spending the time with us today. We know that this is a really busy time of year. We hope everyone has a wonderful holiday season. Our objective here today is to give you something that you can bring back to your organizations that's useful and practical, and hopefully to help your organization better serve consumers. You know, we think this topic's more relevant than ever, and so we're really excited to get into the discussion with you all. In terms of the agenda for today, we'll start with, a lot has changed in the last couple of years. So where are consumers today? What does the consumer look like in 2022 and as we move into 2023? How is healthcare evolving to meet that consumer demand? What are folks doing as they understand how preferences are changing, how utilization is changing? And then how can healthcare organizations, and I think in particular, maybe legacy healthcare organizations, adapt as these changes are happening with consumers and with other participants in the healthcare ecosystem? How can we not just maintain, but increase our relevance to consumers and really build relationships with them going forward? So we'll jump right in and start with, where are consumers today? So certainly the pandemic has permanently altered how Americans live and work. These are just a few of probably dozens of statistics that we could draw from that demonstrate how our lives have really changed dramatically. As of April 2022, 6 in 10 adults reported still not returning to pre-pandemic activities. The second bullet point here I think is really interesting. In 2021, 32% of employed Americans did no work at their workplace, which was up from 18% prior to the pandemic. Then you have, as the illustration on the top left shows, how many of us have just gotten into the routine of picking up something outside of our front door versus venturing outside, in ways that we maybe never would have dreamed of, 10 or 15 years ago. And so just the way that we interact with the world is different. The way we interact with each other is different. And I think that's a really important backdrop as we then think about how this applies to industry and then how it applies to healthcare.
Yeah, that's right, Dan. And that the highlights on e-commerce and online preference is really a nice segue into moving forward in our conversation today, and what we witnessed really in looking to our next slide with the rise of our digitally enabled and that mobile consumer mentality through the pandemic that we saw. and it's going to remain a core preference for our consumers as we move forward. So it's really important for us to kind of take a minute and just reset for a moment and highlight the fact that rising health consumer expectations for necessary goods and services, to everything you just mentioned, Dan, really extended pre-pandemic. And other industries, from banking and finance to hotel and hospitality and retail, benefited from their early adoption of consumer-focused strategies. And with consumer attractive options at their fingertips, only 1 in 10 health organizations are working to advance their consumer-focused infrastructure. Nearly half have yet to focus on a consumer strategy. And so health systems really must advance the charge for that sustained business success. So, in our technology and digitally enabled health industry, consumers and customers, they're truly in the driver's seat now and for the foreseeable future. And it's going to require a partnered approach and paying attention to their ongoing needs from us as an industry to really maintain that ongoing relevance and relatability. And that's so key, Dan.
Yeah, great points, Charlotte. I think the point that resonates the most with me, and it actually is true as we think about the workforce challenges that we're facing in healthcare as well, is that what we're dealing with here, the challenges, the opportunities, the changes, these are not all just wrought by the pandemic, right? I mean, this is a lot of these dynamics were in place long before 2020. And the pandemic either really illustrated what was broken or it accelerated certain dynamics in the market. But certainly there have been changes in the way that folks interact with healthcare in the last few years. And as we look at page 7, it really shows up in the health system data that we have. So while we can look at some stabilization over the last year, when we look at changes in volumes among health system data from 2019 to today, and so looking at October 2022 versus 1 year ago, 2 years ago, 3 years ago, there's generally the total number of visits a little bit up, a little bit down, but not dramatically changing over the last 3 years, and some stabilization more recently. We see some really significant changes in what are some of the core services that health systems provide, right? Discharges down 10% versus 3 years ago. Inpatient surgical cases down 19% versus 3 years ago. And so while there's been some stabilization in overall volume, there's been some real changes in the mix and the nature of our services and our interactions with consumers that certainly have economic challenges, but also have really important implications for just the way that we interact with consumers. The opportunities that we have to engage with them are changing meaningfully as we go forward here. So as we step back then and think about the journey that consumers have, all the way from when they think about their plan options, and many of us have probably just gone through open enrollment, or will be going through it soon here, all the way through to the healthcare visits that we have and the interactions that we have with providers. The overall theme here is that there are certainly more individualized options in 2022 as we ask consumers and survey them. But access, there's a sense that access is narrowing and that the experience is more fragmented. And so that runs through from the plan options, where we're seeing more kind of narrow network options. We're seeing employers more frequently only offering one choice. And we're seeing an increase in Medicare Advantage penetration, in which there are networks that are maybe a little bit more limited that often come with those plans. And then as we think about kind of the individualization of healthcare, when we ask folks, they're reporting a lot of health management activities on a day-to-day basis. So whether it's a fitness wearable, whether it's diet and nutrition, whether it's mental health, whether it's sleep behaviors, there's a lot more opportunities for folks to use technological devices their phones and other means by which they can manage their own health. And when we ask them, they're actually saying they're doing this really not often in engagement with a provider, right? They're doing this kind of on their own, trying to manage their diet, trying to manage their sleep, trying to manage their mental health, and not really engaging with a primary care provider to help manage all of this. So we've got an interesting dynamic here where folks are engaging with health, but not necessarily engaging with healthcare providers. And I think it's important to remember that in terms of the visits, we really don't see folks very often, right? We see them a couple times a year, if they do come in at all. And increasingly, that activity is shifting to different channels. And Charlotte can really speak to the specific site of care preferences that we're seeing.
Yeah, that's right, Dan. And I can't reiterate enough, really that shift in mindset that you've alluded to with our consumers today with the ability to self-manage their health needs. And that is such a nice segue into why we need to think about the conditions or treatments that do necessitate a care visit in, say, a low acuity or a non-emergent care site, as we'll see on the next slide. That is represented on the y-axis relative to the options that consumers have around where they prefer to receive that type of care treatment. So the where, or on the lower x-axis here. And from our latest SG2 research from our National Consumer Survey data, we're seeing higher consumer likelihood and preference for provider office and urgent and virtual care options for minor illness needs. So that shift to the ambulatory and outpatient clinical care setting that we've been talking about at SG2 for a number of years. Now, for consumers needing options for chronic condition management and behavioral health, high consumer preference does remain for a provider office as well as virtual care settings. So we're seeing that theme of virtual care continuing. And then for new prescription or medication refills, certainly consumers are leaning toward provider office as well as retail and virtual care settings to fulfill these requests. But Dan, not to be discounted, insurer-owned options are definitely picking up steam in this area too. So, if we think about that forecast for the rapid shift toward ambulatory, outpatient, and lower cost sites of care for years, we're going to see on slide 10 where we've started to pinpoint the access challenges within key consumer selected sites. These are often called access or entry channels across our system of care, paired with that projected growth at these sites of care, specifically bringing out the imperative for organizations to consider a more shorter term growth strategy. And with specialty care growth projected at 6% over the next 3 years, it's really worth magnifying to highly utilized specialties, which are key needs for our consumers now and in the future. So the question becomes, how can we solve the wait time equation within these sites and specialties to create those streamlined modes of entry into our systems of care? And Dan, you really alluded to this, right? The entry channels into our system of care is changing based on consumer desire, and being able to accommodate both our existing patient customers as well as our new consumers. So that's where pinpointed strategies to really upend these challenges and position forward-thinking teams to more proactively meet consumer demand through those specific channels and services can really help systems get ahead. And by tailoring strategies, it'll provide greater focus when it comes to investing in consumer-directed strategies to drive those targeted upstream health services purchasing in the near term, and then allow for that mid to downstream impact and revenue over time.
I think this is really important, Charlotte, as we look at that specialty care item that you called out. If we think that providing very expert specialty care, tertiary quaternary care, is going to be core to the value proposition for many health systems going forward, man, those access challenges, we're going to have to find a way to work through that, because we can't have that be at the same time core to our value proposition and inaccessible, right? That equation's not going to work we're going to have, we may have all the great front doors in the world, but if we can't get them into the the services that are really core to our value proposition, that's not a winning equation.
That's right. Exactly right.
So given the changes in preferences and demand and utilization, some in healthcare are certainly shifting and evolving in the way that they're seeking to interact and engage with consumers. And as we flip ahead to the next section here, we'll really get into that and talk about kind of how is this changing, who are the folks that are changing it. We use the term disintermediation here. And if you're like me, you needed to go to Google or to a dictionary to figure that one out. I'm going to add a couple other words here because I don't think it's just disintermediation. I think there's dislocation and there's also re-intermediation. And so let's go through those. So disintermediation is essentially removing the middleman, right? So creating a clearer and more direct path for the consumer to access what they're seeking and what they need. And so as more information and more options are available for them to do that's absolutely disintermediation. There's also re-intermediation, which is actually the introduction of new middlemen and new kind of barriers and obstacles for the legacy or traditional path of the consumer, right? To the primary care gatekeeper, and then to the options that may exist beyond that in the care settings. And there's also dislocation, which I had to look that one up, but it turns out that it means a disturbance in kind of the usual order of things. And so I think it's all three of those things really that are in play here. And it's important for us to understand which of those dynamics are affecting us and how, right? Because there's certainly, as we think about re-intermediation, there's all these new entities that are basically trying to position themselves at some point in the patient journey as a new channel, as a new option, as a way to redirect patients from maybe traditional or legacy options. And they may not all be successful, but we certainly need to learn from what they're doing and why they're trying to do it. And going forward, I think, Charlotte, you'll have some information to share with us here. We don't expect this activity and this shift to the outpatient to virtual to change anytime soon.
Yeah, that's right, Dan, and you painted such a great picture too. The disruptive forces certainly that we're feeling here, or as we like to call them, headwinds, certainly contributing to that shift that we're seeing in the ambulatory environment. The types of services that our consumers are gravitating toward to receive, in the office-based and outpatient settings. And as we advance to the next slide. And more specifically, as we look ahead, we're seeing the data reveal that virtual visits will start to account for increased evaluation and management visit volumes. And then over the next 5 years, we're expecting the total number of E&M visits to grow by 8%, yet during the same time frame, we're expecting double-digit declines for E&M visits delivered in the office or clinic space. And many of the disruptors that you've highlighted in the previous slide, Dan, will continue to offer E&M visits as well as other similar services across our health markets in the U.S. And their innovative offerings are really well positioned to deliver on evolving consumer expectations and preferences for healthcare when and where they need it. Or from my perspective, I like to say consumers gravitate to health services where they live, work, and play. And while a considerable portion of evaluation and management visits are moving away from the office and clinic setting, outpatient procedures are moving in, where we expect to see 11 and 17% increases respectively in major and minor procedures, with outpatient diagnostics well positioned at a 10% growth rate. So for our provider systems to really advance in this space and get ahead of the competition, they must evaluate and align their current service mix strategy in the office and clinic space for better positioning to both maximize those E&M visits capture as well as seal procedural growth in these settings, more importantly in the shorter term. So, all this to say too, as we even look ahead, consumers are increasingly confident in navigating their care via technical devices. Dan, you alluded to that earlier on. They want that ability to self-manage and self-navigate, from online scheduling to online check-in, online bill pay. It's created this nimbleness transformation that's really underscoring the imperative for increased diligence in operational savviness as well. And we're going to see this on the next slide. And that can include, the integration of care operations such as automated intake, form fill, further decreasing caregiver workload and working to increase efficiencies as well as data accuracy in order to be able to really solidify sustainability to compete in the future. Added to that, the fact that, every care experience now, and Dan, I like how you really, pinpointed that word, that interaction, certainly contributes to the overall view the customer has of your system. And that's so important because the value of those interactions is going to drive future behaviors and purchasing patterns. And so systems need to consider how they're empowering their care teams to capitalize on reframing the care conversation at those key journey points to shape the impression for ongoing care interactions. And then finally, within our SG2 consumer research and data, we've seen consumer preference, certainly, as we've spoken to today, for virtual health visits, particularly a virtual health visit with a provider's, with an individual's direct clinical provider, take that top priority seat. And in fact, 4 in 5 consumers feel their health needs were addressed or resolved from a virtual interaction. And this is the shift that we've highlighted earlier in how consumers seek care for a minor illness. That increased preference certainly continuing as we move forward. So this ease of access into your system of care, think starting a virtual visit in an instant, walking in for care, longer hours of availability. Much of the disruption, Dan, that we're feeling and that we've highlighted they've proven with their consumer directed strategies and offering. That's what's going to keep consumers focused on your system and allow for that trust to be established and then that return business to follow.
Yeah, I think, it's interesting. This is kind of the little secret of quote unquote consumerism, as I've been kind of in and around, this discipline and this set of activities and dynamics for, a dozen plus years now. It's not necessarily sexy. I mean, when it comes down to it, being consumer friendly, and we'll talk about this more later, it comes down to operational changes, and it comes down to change management and thinking about your workflow differently and thinking about those interactions differently. It's really hard work, right? It's not about just opening up a new innovative primary care site, right? Although that may be part of it, it's really about hard operational change. But in addition to operating differently, we do need to still consider the channels that we're offering, right? And so as we flip to the next page, these all will be required. There are certainly challenges with some of the new models. I mean, as we think about the left-hand side here, some of the traditional ways, and I think, channels that many organizations have and have had for many years. We've certainly got hospital-based sites, right? Plenty of those. Many have built out ambulatory facilities. There may even be some sites that are co-located at non-healthcare sites, right? So a retail clinic at a grocery store, for example. But all of these are situations where the patients are coming to us, right? We're not going to them. And then I think where we have work to do is certainly where we're kind of bringing the care to them, right? Charlotte, where they live, where they work, where they play. So whether it's virtual, whether it's care in the home, whether it's mobile or at the workplace, I mean, these are not easy, right? There are certainly benefits to them, right? You may be able to have lower fixed costs in some of these cases. We certainly should be able to drive better patient satisfaction through the convenience that they offer. And there may be some alternative revenue streams, but let's be really clear, right? That I think a lot of these have unclear economic models. And in some cases, there may even be increased staffing needs, right? And so this is a different economic model. It's a different model of working in terms of bringing care to consumers. but I don't think there's any doubt that it's going to be critically important. And we can't build it all on our own, right? We can't build this entire spectrum on our own, nor should we. And so as we think about, and as we flip to the next page here, as we think about the front doors and all of these access points rapidly changing, and all of these new types of front doors, right? So from capitated primary care, direct primary care, virtual care, all kinds of different ways for folks to access us and channels that we need to be thinking about offering. Really important for us to think through where we build, where we partner. In some cases, if you have the capabilities, you may be able to build out a capitated primary care offering, right? But a lot of systems don't, right? And so maybe that's a place where we need to look at potentially partnering, or how we work with those that are in the market doing that already. Whereas many health systems have been able to build out urgent care offerings, whether in partnership or on their own. But even then, it's about making sure that we're truly delivering a consumer experience, right? And not just having kind of a hospital outpatient department that's called an urgent care center. So I think a lot to think about in terms of not just the operations, but the channels that we're offering. And it's not just front doors, right, Charlotte? I mean, it's multiple doors as we think about the system of the future, right?
That's right. It's variability indoors, Dan, to your point too, and really integrating creative strategies to some of your other, your other highlights with how we need to think creatively about creating those mechanisms for our consumers to enter into our environments of care, or into our system of care. And this certainly paints a very clear picture of our reality, and that the entry points into our system of care have evolved into multiple points of accessibility for today's savvy health consumers. And we'll see this in the upcoming slide too. Really important to take note that the key to understanding is really being able to acknowledge and recognize how your system's best equipped to help your consumers and customers in your markets, in your service areas, navigate to and through those doors successfully, both in the near future and for other future health needs. And that's what a lot of the disruption out there has done really, really well. They've created that open door entry point so that consumers really can walk through with ease. And so, as we advance the slide, the question now becomes, in our increasingly complex system of care, how are we going to, evolve to solve the challenges that are here to stay? Certainly we've talked about the multiple doors that consumers have, the options at their fingertips. And if we take it one slide further, how are we working to get them into our doors and really earn their loyalty so they keep returning to us from care? And it's that transition in mindset, Dan, from really meeting our consumers at their point of care to meeting them more at their point of need. And not to mention, what we've talked about, the innovative disruption that's really occurring in our backyards, which we like to think about in 4 categories. Big retail, CVS, and the Walgreens Village MD venture as an example. Big tech, such as Amazon and One Medical Venture. Our venture capital-backed medical groups, such as ChinMed, offering chronic condition management services, and then payers as providers, or as we like to call it, payviders, such as your Optums or your Uniteds. And as health leaders, we simply must tackle consumer awareness and preference strategies to better meet our consumers and customers where and when they truly need us.
That's right. And so I think what some of the concepts we've teed up here, there's a lot of complexity to it, but and it's hard change, as we talked about. But actually where we start is pretty simple. And so as we talk about how we can adapt and try to bring this home for you all and get you on with your Thursday here, it's really about starting with basics. So as we look at page 20, the voice of the customer really needs to be our guide and our starting point, right? It's as simple as it could be. We have to start by listening. We have to start by listening to the consumer, and we have to listen to the providers, right? So we have to listen to our caregivers. The interesting thing is that even in healthcare, an industry that has been perhaps a little bit behind other industries in terms of harnessing the voice of the consumer, we actually do this a lot at healthcare organizations when we're doing marketing, right? A lot of marketing departments for many years have been doing consumer surveys, have been doing focus groups and patient family councils to get input. And so this is not necessarily a new muscle. I think there's probably an expansion and a deepening needed, and thinking about different ways to deploy it, which we'll cover. But then I think it's also really importantly about the provider and the caregiver, and understanding and thinking about them in some ways as customers, right? Or at the very least as partners. And we need to understand their input on the interaction as well, because really any interaction that we're having with a consumer, well, it's either digital or it's between two people, right? And so we need to understand the input from folks on all sides of the equation here. There's a lot of really great disciplines and techniques that can be used to do this, and we have to make sure we're fitting the right technique to the right situation. We're not going to get into all of that here today, but this is a discipline and a science unto itself that's really important for it to be a muscle that we have in our organizations.
Dan, I think it's so key that you've highlighted really looking at both your consumer and your clinical providers as customers. I think that's going to be a really powerful tool for systems moving forward to be able to partner with both people and environments in order to be able to really move the needle on their initiatives.
Absolutely. So what do we do with it then, right? Now we've got all of this information and insight. So what do we do with it? As I mentioned, we've been using it for marketing for many years, right? There's probably different ways we can incorporate it and integrate that data into our marketing to be even more, kind of tailored to the individual consumers that we're trying to serve. But I would love to focus everyone's energy and on numbers 1 through 5 here versus number 6, because the way that we really make a difference for consumers is by using consumer insights and integrating them into the way that we work on a day-to-day basis. And so it's having those insights, number 1. It's having that consumer perspective embedded in your C-suite and on your board of directors. Having people who really feel accountable to the consumer and whose job it is to be accountable to the consumer. Integrating insights into strategic planning and decision making. I think I've seen organizations doing a better job of this in recent years, but I think more opportunity on that front. As we think about how we create value for consumers in our market, we need to really think about segmenting them by lines of business, and by demographics and by attitudes, and making sure that we have the right value creation plan for a Medicare Advantage segment versus a commercial segment, for example. And then 5 might be the most important here, which is embedding what we know about consumers in the way that we operate on a day-to-day basis, in the way that we provide access, in the way that we build the experience, in the way that we price our services, in everything we do on a day-to-day basis, that we're informing that with a real understanding of what consumers want, how they actually navigate the system on a day-to-day basis, and how we can make those interactions really meaningful and build a long-term relationship. So Charlotte, why don't you maybe take it from here at a relatively high level and maybe start to talk about how we put this into action.
Yeah, thanks, Dan. And I will definitely reiterate that the importance that you just pinpointed, I couldn't have said it better, and really, embedding consumer perspectives and pivoting toward that total value experience. It's absolutely key for systems to be able to compete and compete well too. And with today's consumers having numerous options, really the ability to meet their unique needs requires a digitally sound, adaptable, and coordinated care journey. And if we advance the slide, it really goes to say, how are we supporting our consumers so that they can navigate successfully across our system of care? Not only is it going to take a partnered approach to prioritize strategies and support them, but then directing them to the most appropriate care setting based on their clinical need. And it's going to require us to rethink how we meet our consumers with focused investment on ambulatory and community-based offerings, really providing them with that streamlined access into our system of care and creating that maximum impact at key journey points. And if we take this one step further into the next page, it really underscores the importance of integrating services designed around consumer lifestyle. So again, that live, work, play mindset, along with continued focus on clinical outcomes toward that total value experience for the customer. Certainly all key factors to secure overall satisfaction, trust in the direct clinical provider for a consumer, and then trust in the health system, as well as customer loyalty over time. And it's why our system of care maintains that intentional cohesion. It enhances the experience for our consumers and customers, driving that connected volume and downstream revenue potential. And so if we advance forward in our conversation and discussion here today, Dan, we have to think about measuring our success differently as health organizations. So rather than focusing, and you spoke to this certainly earlier in our conversation, Dan, on, if we focus on caring for everyone in the market, all of our consumers in the market, will only meet a portion of their needs. And so focus really needs to be tailored to specific needs of the consumer or customer segments that you're best positioned to serve in your market. And from our SG2 consumer research and data insights, key loyalty factors to carry your consumers and customers for a lifetime sits at a powerful 77% opportunity from a national view to attract and capture your decision-making mom audience. That 77% extends to 87% opportunity to retain your customers when factoring in loyalty for a routine care visit. So, 87% of your consumers in that segment want to be loyal. Now, if we factor in generational preferences specific to just the mom population segment to start, it allows for us to start to identify pinpointed attraction and retention strategies. So, if we advance our slide just a little bit more, we can see some of the generational preferences specific to that first segment. And the data points really help to bring out that, we can evaluate the likelihood of a generation to return to the system for care, such as the silent or the traditionalist generation, and pair this with purposeful strategies to keep them in your system. We can also evaluate the likelihood of, say, Gen Z to remain with a system only for routine care, meaning systems truly need to think about strategies to appeal to this generation for other health services utilization. And then if we look at our other segment and the female head of household population, the opportunity to secure your customer base actually looks a little bit different. So we'll move forward a little bit in our animation and take a look at this population. And the 73% extends to 83% who would like to be loyal with a provider system. So looking at these generational preferences specific to this population segment, we can pinpoint in the data the importance of, say, Gen X, millennials, and Gen Z placing on the ability to get into care and be accommodated. And in the daily on-the-go mentality of these generations certainly highlights how we must integrate strategies to ensure the populations can enter our systems of care in ready fashion with confirmed appointment booking that also meets their expectations around time to be seen, as well as convenience and location for their health need. All of these data points really reinforce the need for provider systems to be focused and targeted with who you're trying to attract based on pairing consumer needs with your goals and objectives. And so, as we move into the next slide, and keeping with our strategy around pivoting toward establishing those unique relationships with our consumer and customer segments and populations to really build that trust and further cement the value for them over time. This translates directly to how we as an industry, Dan, should focus on targeted strategies to secure that overall customer lifetime value with a single system or organization, or that total spend per customer segment over a 3 to 4 year time frame. Customer loyalty, certainly is one of the most important competitive advantages for a health organization. So much so that a loyalty driver analysis, such as in the sample analysis, can really help evaluate system upstream strategies and consumer behaviors for the selection of specific access or entry channels. So exactly how we've started to articulate the importance of really being able to identify those key entry channels for your system. Systems can then attach an attributable share of wallet spend per customer by entry channel, and it really helps to highlight how customer lifetime value and share of wallet metrics become crucial for understanding an organization's effectiveness in developing those consumer and customer focused strategies and executables. And so, as we move into the following slide, it's going to be key for us to really understand the impact that an access channel has on retaining the consumer or the customer's total longitudinal spend over time. And in our sample analysis here, what we start to find out is that the channels of physical therapy and occupational therapy, if we advance in the slide, we'll see that those two channels that channel together has the highest customer lifetime value and really is also the most impactful in driving the highest percentage capture of customer wallet over 3 years. What's even more is that it accounts for the highest attributable downstream revenue for this time frame. So, Dan, this really goes to show how our health systems have an opportunity to better understand what we would consider other consumer-directed access or entry channels into our system of care. And those other access or entry channels, such as PT and OT, great to highlight. And from my work on the system side, they've often served as supplemental or wraparound services. And now they really deserve focus on their own as key strategies for consumer attraction, paired with that ongoing relationship management to keep the focus on serving customers over time within a single system. And then, if we move forward a little bit more, identifying a consumer and customer focused strategy is certainly imperative, particularly when our consumers or our customers require co-utilization of care service, such as in our medicine and service lines. In the case of this sample market analysis, the individuals needed both cardiovascular care with a likelihood to also need orthopedic care. And when viewing share of wallet in the sample market, again, how much a customer spends with your system versus a competing organization and that loyalty distribution, what we saw was 80 to 100% of customers are loyal for cardiovascular services over time versus individuals who are somewhere in between. And when we applied those data insights for how well we're serving our cardiovascular population who also had orthopedic needs, the story changed. And a larger portion of consumers were only utilizing the sample system for up to 20% of their orthopedic needs. All this really translates to consumer segments receiving, that consumer segment receiving fragmented orthopedic care from the sample system. So, as health leaders, it's key for us to focus on serving specific segments by utilization pattern for key services with your system, and it's going to require a multidisciplinary approach to ensure both business streams or even more business streams are really secured and those customers stay with your system for multiple care needs. And so, Dan, I think, that's a really nice place for us to kind of highlight some takeaways that we can leave our members with.
Yeah, well said, Charlotte, and really good insights on kind of where we could potentially be focusing here. There was actually a question in the chat that I want to pick up on a little bit around, how do we compete with disruptors and private equity backed players and these large corporations that are kind of deploying these direct to consumer plays where maybe that isn't our kind of traditionally our value proposition or our strength as healthcare organizations. And I think the first bullet point here is really important, right? We, health systems, have a breadth and depth to them that can really differentiate in building an end-to-end relationship, right? So if you're out there offering a point solution, you may be able to have a really great point solution, but you're never going to have the ability to build this end-to-end relationship that health systems have, right? And so really important for us to think about how to leverage that advantage and make sure it ends up being an advantage rather than a disadvantage because our system is so disconnected, right? And it feels like silos and individual point solutions that just happen to be under one brand, right? And then, I think the key takeaway around segmentation here is really important because, one consumer is one consumer. But there are ways that we can think about value creation strategies for Medicare Advantage or for, as Charlotte spoke to, for moms with smaller children, right? And how do we build loyalty with that segment? And then I think there's also an element here where if you are coming at this from the perspective of a publicly traded company or a private equity backed business that really at the end of the day is focused on returns for shareholders, you may not have as much focus on stakeholders in the community. I think that's actually another really important way that that kind of stakeholder driven, mission driven organizations have an opportunity to build a different level of relationship with their communities and their consumers, by investing in the local economy and helping to address some of the root cause challenges in the community. A really important way to also build that relationship that shouldn't go overlooked. All of this certainly means thinking differently, adopting a different lens for how we make investments in tools and capabilities and services that may not have kind of the direct and immediate return that we're used to having when we build a facility, right? When we build a facility to provide services, it's very clear, at least, kind of how we're going to be able to generate the return on that. With some of these investments that need to be made in people and workflow and technology, it's maybe a little bit less clear, but I always come back to, who better than Steve Jobs when he talks about dots connecting, right? So what Steve Jobs always said about these kind of innovative investments that Apple would make is that you can always see how the dots connected when you look backward, right? The key is trusting and believing that the dots will connect going forward, right? And having the faith that if we do the right thing for consumers and for our communities and really put them first in the way that we design things, that the dots will connect going forward, and that we'll then be able to look back and say, yeah, we did the right thing by doing that. And it wasn't just the best thing for consumers, but there actually was a positive business outcome from it as well. So again, we're really grateful that you all spent this time with us. I think we'll have the chance to take a few questions now, and there've already been a number of them getting loaded into the chat. So maybe Charlotte, I can let you navigate to the first one there if you want to take that.
Yeah.
I think it was about pediatrics. If we go
yes.
here.
Charlotte, there's a question. The first question has come in. Thanks to everyone who submitted via the interface. The first question, Charlotte, is how did the site of care trends change in the context of pediatrics?
We can absolutely go back and take a look at some of those numbers, and would be glad to follow up on that specific to a pediatric audience.
I think, just at a high level, I think it's easy to overlook how different the system of care is and the needs of the patients are, right? And so, and in some ways, pediatricians, were on the bleeding edge of offering different access, right? Offering, kind of early morning, late night, weekend access in a way that actually adult primary care has been slower to adopt. So I think that'll be really interesting, Charlotte, to see what you have to follow up with there.
Absolutely, Dan. And even as we look to the specialties too, certainly there are some consistencies with access to pediatric subspecialties as we're seeing in our adult population too, and just some of the challenges with some of those needed specialties and being able to get the availability for all of the populations that we serve.
Yeah.
Okay.
So, Hayden, go ahead. I'll let you kind of keep facilitating here, and we can just be the A part. You can be the Q part.
Sounds good. Dan, there's a question that may be in your lane. The question is regarding health management. What portion of the total healthcare spend would you say is in health management, and how should we think about economics for health management?
I mean, I think that second question is actually more important. And Charlotte and the SG2 team may have perspective on this as well, based on the data that they have. But I've seen numbers. If we think about just kind of the CMS estimates of health spending on kind of traditional healthcare services, it usually comes out somewhere around an average of $10,000 per person per year. I've seen that when we account for health management activities, I mean, there's a million different ways you can define that. I've seen it be as much as an additional $5,000 per person per year. So it can be really meaningful. Now, those dollars are really spread out on a lot of different things. The economics question is more important because in a lot of ways, we can think about some of these things as loss leaders. And if you don't like that term, as a way to build relationship with folks and offer services to them that will make you more top of mind, will enable you to learn things about those individuals, will enable you to have interactions with them where you can then show them the other services that you have available. So I think the economics question is really important because it's not just about kind of direct bottom line from those services. We need to think about those in a more well-rounded way.
That's right, Dan. I would add to that too, for us as health systems, that relevance factor, right? And being able to stay relevant with our audience while finding that balance for their health management needs and convenience too. And so, that really underscores how we have to advance our consumer strategies, leaning into different ways of thinking about innovative offerings, and tailoring those to the consumer and the customers, whether that be, health management offerings or a combination of health management and other.
Okay. Charlotte and Dan, we've had a couple questions come in about the front door of healthcare, with questions about whether there are also side doors, i.e. handoffs for specialty consults. The questioner also wants to know, will coordination of care be a differentiator here, or will the consumer assemble their own distinct series of healthcare transactions? And Charlotte, perhaps you can take the first crack at this one.
Yeah, absolutely. And certainly, as we shared earlier, we've evolved from a front door to multiple doors. So, and that includes side door offerings. Actually, they're all doors into our system of care. And it's really about being strategic with helping your consumers understand where they can enter your system of care, and then being able to the other part of the question, to help them navigate successfully. So, Dan's analogy was perfect with, having that close tie to the consumer across their entire interaction journey. So, not just making sure that that one interaction is successful, but that their subsequent interactions are successful so that their entire care experience is stellar with your system wherever they need to enter it.
That's right, and I mean, all you need to do is go and look at and analyze the data as to how many people kind of fall through the cracks, you know, from referral to scheduling to actually doing the visit, right? And what an opportunity there can be there, you know, if we do that right. And certainly consumers will have the option to cobble together their own system of care, but I think it's our responsibility to make sure they don't have to do that, right? So I think that's the key here. Hayden, I love the question about a real life story, and maybe I can take the first crack at that one, because there is a real life story. There's many of them around the country, but one that I would highlight is a 2-hospital system on the East Coast that I've had the privilege of working with for the last 5 years or so. You know, based in a community that has had some challenges over the last, you know, several decades, and is one of those communities that has had population declines and challenges with poverty and violence, and so there's a couple things. One, you know, they built a program for seniors that they knew they were not going to make money on, but that they had faith that the dots were going to connect in terms of building relationships, where it's all about kind of an in-home assessment, setting them up with with kind of care managers that they call them life care managers, to help them navigate and help them get the right appointments scheduled. There's a transportation element to the program. There's a social and a wellness element to the program. It's a monthly subscription service where they have value-added services that are kind of aimed at seniors in their community. And they've had, you know, especially since the pandemic has stabilized a little bit, they've had really wonderful increase in membership, and they're learning so much from interacting with these seniors on a day-to-day basis about what more they can do for them now. So that's one thing. The other thing they've done is actually a neighborhood initiative where they've partnered with local companies to make investments in housing and in education, and in really important wellness services. So there absolutely are these examples around the country of not-for-profit health systems investing in their community. And I think the one takeaway for me on that was finding those like-minded companies that are in your area that maybe would be willing to share that investment with you.
That was well said, Dan.
Hayden, do we have time for one more, or do we need to wrap up here?
I think we've got time for one final question. We'll do a quick lightning round. This question is, how can systems best quantify an investment and a return on investment around consumer loyalty?
Go ahead,
So
Charlotte, if you want to start.
Yeah, I think that there are a couple different, you know, metrics to point to, and that's really looking at the share of wallet spend, or the total spend by customer on your organization versus competing organizations. So that's one metric to look at. And that certainly is, you know, a percentage of the customer lifetime value metric that can be added onto that, or, you know, the likelihood of a customer, you know, being able to spend, you know, their health services funds with your organization over time. So a couple of really core metrics that we can bring through certainly and help support in our analytics at SG2 in order to be able to inform return on investment strategies, and certainly the short, the mid, and the long-term impact of that.
Yeah, I know you and the team at SG2 have some wonderful tools around that, Charlotte, around that exact question. And I think as as EMRs and as claims data have enabled us to take different looks at the data, we need to take advantage of that, right? Like using the same metrics and the same inpatient data that we were using 15 years ago just doesn't cut it, right? We have the ability to look at unique patients and to understand how they're interacting and how they're spending, and we have to do that. Absolutely.
Yes. Yeah. Thank you, Dan. And it's certainly going to help us better meet their unique needs, both from an individual standpoint and a customer segment standpoint.
Okay. Great. Well, just want to thank Charlotte and Dan. We're at time. I also want to thank the audience for all the questions. And as a reminder, you can download the related resources in the webinar interface. And on behalf of Kaufman Hall and Sg2, thank you and have a great day.
Thank you.